Now this is the anterior midline of the neck, the one which lies between the sternocleidomastoid base of the mandible, symphysis mentae, hyoid bone, thyroid cartilage, trachea, cricoid cartilage, trachea, and the jugular notch. This particular triangle, we call it as an anterior triangle of neck. Each triangle of neck consists of a digastric triangle, a submental triangle. There are two digastric triangles, but there is only one submental triangle. Each side of the neck shades half part of the submental triangle. This is the carotid triangle, and this is the muscular triangle. So there are triangles which we can see in each half of anterior triangle of neck are digastric triangle, half submental triangle, one carotid triangle, and one muscular triangle. Let us talk in detail about the digastric triangle of neck. Each half of the neck consists of a digastric triangle, which is a part of anterior triangle of neck. The base is formed by the base of the mandible and an oblique line extending from the ramus of the mandible to the mastoid process, and antero-inferiorly it is formed by the below and anteriorly by the anterior belly of digastric, below and behind by the posterior belly of digastric and stylohyoid. Roof is formed by skin, superficial fascia, deep fascia, that's nothing but the investing layer of the deep cervical fascia, and the floor is formed by above by in front by mylohyoid and behind by the hyoglossus. This is the base of the mandible in oblique line extending from the mastoid process to the angle of the ramus of the mandible, below and in front by the antebelly of digastric, below and behind by the posterior belly of digastric and stylohyoid. Roof, skin, superficial fascia with platysma and investing layer of the deep cervical fascia. The floor by mylohyoid and hyoglossus. Now coming to the contents of the digastric triangle of neck. You can see this is the submandibular salivary gland, facial artery, facial vein, nerve to mylohyoid, and this is a hypoglossal nerve. Facial artery, facial vein, submandibular salivary glands, nerve to mylohyoid, and hypoglossal nerve. Draw an imaginary horizontal line. This is a master. This is the digastric triangle. Above by the base of the mandible, an oblique line extending from the mastoid process to the angle of the ramus of the mandible. below and in front by anterior belly of digastric, below and behind by posterior belly of digastric. The muscle which intersects the posterior belly of digastric is the stylohyoid. This is the floor by mylohyoid, and this muscle is hyoglossus. This is facial artery. This is facial vein. This is submandibular salivary gland. This is nerve to mylohyoid, and this is hypoglossal nerve. This is the diagrammatic representation of a digastric triangle of neck.